So because it's been quite a chronic condition, we started our therapy 3 days ago using shockwave therapy. We use radial pressure wave. We use the Chattanooga RPW2 device at 4 bar pressure. And we use a transmitter called the Deep Impact 15. That's made of titanium, so we get quite a lot of energy through there. And instead of the energy being radiated out into the tissue, it's I don't want to use the word focus, but it's certainly channeled all the energy into that area. So after that, you've had a couple of days now. How's the pain been since then?
The pain is significantly reduced. I'm looking at a 3 to 4 at the moment.
Okay.
So it's definitely helped a lot.
Okay. And what about, so rather than getting that 7 out of 10, it's now 3, 4 out of 10.
3, 4 out of 10.
Okay, good. And your sleep, because that was being pretty disturbed.
That was also being disturbed. I'm sleeping much better. I still have a pinch every now and then, but not near as bad as I used to before the treatment.
Okay, wonderful.
So it's definitely helping with that as well.
Good. Okay, so for those of you who use Shockwave, you know that we would normally just do that once a week. And the idea is to restart the natural healing process. This has been going on for 5 years now, so we needed to restart the healing process. And for those who don't know, Shockwave is a pro-inflammatory. So what we've done is we've waited a couple of days for that inflammatory process to maximize, because now we're going to introduce LightForce Therapy. Now, LightForce Therapy is anti-inflammatory. So now the inflammatory stage has done its job, we need to get rid of it, but it also has a direct influence on nociceptors. So we can address our patient's pain. And what the research has shown us is if we can front load that, all the better. So what we've agreed is that we're going to have a concentrated group of sessions on LightForce Therapy this week. At the end of the course of treatment, we will then ask you how you got on.
Yes.
Okay.
Definitely.
And I'm going to put in some information about the patient. And then the machine automatically gives us our protocol. Okay. You will see it's quite a short treatment time, but very effective. And we're going to use an on-contact head. Now, the reason we've chosen to use on-contact, the research shows that we get 15% more energy than if we was to use it off-contact. Okay. So if I could ask you to lay face down. While our patient's getting ready, now, quite obviously, I would normally treat from the affected side, but because of the video, we're going to work from this side. Okay. So I press standby. The machine takes about 6 seconds to warm up. You will hear a fan working because there's quite a lot of heat generated, and the fan's obviously there to dissipate the heat. So we start our therapy, pressing here, and we're going to work over that facet joint area and the area of referred pain. Okay, so having treated the area of referral, that's the source of pain. But what we also know is that pain is controlled at the dorsal root ganglion. So I also want to address the nociceptors in that sensory organ. So for that, I'm going to tell the machine using the perfect protocol, because I'm going to tell it the area that I'm going to work, which is 50 centimeters. I'm going to use the wattage. Now, I've just used 15 watts on the patient and they were quite happy with that, so I'll choose 15 again. And then I need the fluence. or the irradiance. This is the joules per centimetre squared, and it's this dosage that makes the big difference. Now, if you're not sure, these dosages are available, and you can find them on the Walt recommended dosage guide on the internet. But for a quick way of doing it, just think of 6 joules per centimetre squared for superficial, and think of 15 joules per centimetre squared for anything that's deep. And then either take 20% off or add 20% on, depending on whether it's acute or chronic. So we have a facet joint, which is quite a deep structure, and we want to get that dorsal root ganglion. So we're going to have 15 plus 20. So we will have 18 joules per centimetre squared. Now, if I now press the equal sign, you will see that I get the recommended dosage. The machine's worked it all out for me. So once again, I press standby. Now, when I'm working over this area, because it's quite a small area, I don't want it to get too hot. So if you notice, I'm working a spiral pattern out to about 2 centimetres away from the dorsal root ganglion, and then I work back in, and then I just stop over for that 1 second, and you saw the patient there, it gets quite warm. So never hold it there for more than 1 second. When you're dealing with pain, treat the source of pain, but also where the pain is controlled. How did the treatment feel? I know it got a bit warm on a couple of occasions there when we're working in a small area.
Yeah, there was a small patch there. I felt it got quite warm, but otherwise it was just a nice warm sensation, no pain whatsoever, and it felt good.
Good, okay. Now, if I could ask you to stand up for me,
Okay.
and just have your hands down by your sides, and when you bent to the left before, you felt it quite stiff, but when you bent to the right, you had pain.
Yeah.
So post-treatment now, let's try that movement again. So if you could slide your hand down to the left. How does that feel?
Feels good.
Good. And slide down to the right.
Feels good.
Good, wonderful.
Okay.
Sit yourself back down. So there we are, look, okay, we've made a difference in our pain-free range of movement. We have our visual analog scale here. We started today at 3 to 4. Where would you put on my smiley face visual analog scale now?
I would say it's about a 2.
About a 2. Okay, so that's great. Okay, we're always looking to make an improvement. You get what's called a latency effect because we worked on the cells within those pain nerves. They can continue to work over the next day. Yeah. So you should find tomorrow you'll get even better.
Even better.
Okay. But at the end of the course, we'll meet you again and hopefully we'll resolve your problem. Okay, so here we are in our follow-up treatment. Just as a recap, we used Shockwave last Friday, and then the idea was to wait a couple of days for the inflammatory process to maximise, and then we started with a concentrated course of LightForce Therapy. Okay, so it's Thursday here now. We've had 3 sessions of LightForce Therapy. What difference has it made to your life?
I can most definitely feel the difference. I'm not in as much pain as I used to. And if I give you an example, just this morning I was scrubbing the pool, and it's quite a large pool, and I have to scrub all the way around and like bend.
Yeah.
And I did all of that, and now I managed to stand up fine. I wasn't in that excruciating pain I normally am once I've scrubbed the pool. So there's still a bit of a slight pain, but I can feel a huge difference just from the few sessions we've had. And it's such a relief. After having pain for 5 years, this is heaven. This is heaven.
Well, that's great to hear. So we know we're going in the right direction. Absolutely. So we're going to continue with that. So our patient is doing really, really well, I'm pleased to say. Today she's reporting, hardly having any pain whatsoever. We've been using a combination of Shockwave and LightForce Therapy. The Shockwave Therapy, we intervene on a Monday, and then we allow 24 to 48 hours for the inflammatory response to maximise. And then on days 3, 4 and 5, so Wednesday, Thursday, Friday, we intervene with the LightForce Therapy. And this has worked really, really well. So I've shown you in previous videos our technique for the LightForce Therapy. So today I thought I'd show you the technique that we use for the Shockwave Therapy. And we're going to start by releasing off the fascia. And for that, we've got the Chattanooga RPW2 with an adapter and a scraper periacter. Now, this is not using Shockwave. It's a different technique for those of you who are using Shockwave, and I'll show you that today. So we've set up the parameters on the device. You use no more than 3 bar. This is set at 2.5 bar. And we're going to work at a 45-degree angle, and you will see and feel where the fascia is bound down. So, we turn it on, and we start. So, now we're going to address the facet joint, which is the patient's problem. So we're going to swap transmitters. Now my preference for facet joint pain is the Deep Impact 15. It's made of titanium rather than stainless steel, so we get more energy deeper into the tissue. So plenty of gel. So this is what I mean by plenty of gel. Good, so there we are, that's our Shockwave Therapy. As I say now, we're going to leave this until Wednesday, so that's 2 days' time. The patient has been instructed not to take anti-inflammatories in that time, should it be uncomfortable, because that will negate the effects of our treatment. So, we'll join you again at the end of the week and let you know how we get on. Now, when you came to see us initially, at rest you were getting a 4 out of 10 on our pain scale, but it could go up to 8 out of 10 because your work is quite physical.
Yes.
Okay. So now we've concluded our treatment. What level of pain have you got?
I have to say a 1.
A 1?
Sometimes below a 1,
Okay.
but it's now sitting at a 1. I barely feel anything. It's amazing.
Oh, that's wonderful to hear.
Pain is gone.
Okay. And what about, I mean, because you've got quite a manual job, you have scrub swimming pools and everything. Yeah. And you know, you after a day of that, you were in a lot of trouble.
I was always in a lot of pain by the end of the day, where I was almost brought to tears from the pain in my back. And now, since I've had this treatment, I'm doing my daily job and I don't feel that pain anymore. I get home and it's so refreshing not to have that pain. It's gone.
Oh, that's wonderful.
Yes.
And what about that disturbed sleep that we were getting?
That has also gone because I don't get those twitches in my back, like, you know, like the nerves are pinching from the pain. That's also gone, so now I'm getting a good night's sleep as well, and it's amazing.
Oh, that's wonderful. Well, I'm glad that after 5 years of suffering,
yes.
we've managed with our combination therapy to help you out. And once again, thank you so much for sharing your story with us. Thank you.
You.